So in the mat return, there's a section that we have focused on that's called joint health for jiu-jitsu. Let's talk a little bit about kind of what that's all about.
Sure. So we're both functional range system certified providers, which is it's just so the FRS is just a system of joint training. And one of the tools that they use is going to be a controlled articular rotation or a CAR. Now, what is a CAR? A CAR is an isolated joint movement, meaning that how do you know how healthy your joint is can your joint perform the movement without compensation, without pain, and it kind of gives you essentially a good insight on kind of your joint health, right? If let's say you're doing it and you don't have necessarily you don't have good range of motion quantity, like if you're not moving that far without moving and cheating, that says, hey, maybe like this is a problem, right? So this can both be a self-assessment to give you an idea of how healthy your joint is, but two, we can also use this as like a kind of like joint flossing, right? So like how do we clean the cobwebs away if someone's tugging on our elbow? We had we do a class, someone's just cranking arm bars for the whole class. How do we make sure that we don't have any kind of like long-term repercussion? Essentially, we move our joint through its full range, right? Because not every time that you go to a class, someone cranks on an arm bar, like you're not going to get injured. But if this happens over and over and over again, maybe there's a few times your elbow gets popped, you're slowly losing your range of motion. And I would say loss of elbow extension is going to be fairly common. So in addition to just getting better at awareness of armbar defense, using these joint health practices, these CARs specifically for the elbow is going to be a great way to maintain your elbow so you don't have those significant limitations.
I agree. So control articular rotations. I mean, we're going through each joint, number one. Number two, it's a way to keep your joints healthy. It's a way to assess your joints. So if you were like, hey, I don't know what to do. I have a stiff shoulder, or I want to loosen up my shoulder or get my shoulder moving better, we have a specific movement for that shoulder, for that elbow, for that knee or that hip. And here's the thing too, we're going through a rotational move. It's not just going up and down. We're moving the joint in a rotational way that's going to help kind of grease that joint capsule and get that joint moving in a better way. And also you got to think about jiu-jitsu injuries. How do they occur? A lot of these injuries are rotational, kimuras, Americanas. If you're looking at, leg injuries or knee injuries, if you don't have good rotation in your knee joint, if you don't have, the knee just doesn't bend and straighten, it also has a rotational component. You have a little bit of that rotation in there. You have a little bit of rotation in your hip and adequate, ankle mobility that could save you. That could really protect you, from at least getting, severely getting injured, maybe even getting injured altogether. But having good joint mobility and having these practices as like something that you do consistently it is a game changer. And I think like the way that we take you through these things, like Mike's taking me through these movements, he's literally going through every like aspect of the proper way to do this thing and talking me through it just so you guys can see. And it's like I think we both can kind of see certain things in there, but also it just shows you a really precise way to do these things pretty accurately.
Yeah. And, and I would say like a lot of times, like you see people online, people ask me questions. I have, what can I do for my shoulder? And if I don't assess somebody, it's very difficult for me to give information, whether it's a strengthening exercise or a mobility exercise or a stretch. I would say a controlled articular rotation is probably the one intervention I would give to everybody. One, because if you have the joint, you can train it. Two, it's very easy to regress, right? So if it hurts, you reduce your range of motion, right? It gives you an idea of your closing of pain. If it doesn't hurt, you can kind of progress. You want to strengthen it, we can start adding like either like an internal load with a self-imposed isometric, or we can add an external load, which is we add a weight of some sort. So in my opinion, it's like the one intervention where I'm like, I don't know who you are. As long as you can follow our guidelines and do it without, irritating, I would give this to someone if they have like day one injury, or if they're like sports performance. How do we mitigate injury? How do we get them better at jiu-jitsu? So it's one of those things where if you know how to do it, you know how to modify, anyone can benefit from it.
Yep, absolutely.
Yeah.